So good evening all. Today our topic of discussion is the NPH, which means it's a normal pressure hydrocephalus. So it is a syndrome of dilated ventricles with normal intracranial pressure. So in this condition, so the CSF pressure was increased and the ventricles are dilated, but intracranial pressure is not dilated, increased. So that's what it is called as a NPH or normal pressure hydrocephalus or low pressure hydrocephalus or occult hydrocephalus or hydrocephalic dementia. Next, what are the causes? What are causes? Simple. So CSF pressure was increased and the ventricles are dilated, but the intracranial pressure is not increased, which means so the obstruction is not within the ventricular system. So if the obstruction is presenting within the ventricular system, so there is rapid rise of the CSF, which causes the rapid rise of the ICP, intracranial pressure will take place. Now, so the obstruction is not within the ventricular system, so which means so the patency of aqueductus ileus was maintained. Next, which is the problem? So the problem is mainly at obliteration of the subarachnoid space at cerebral convexities. So when the obliteration of the subarachnoid space is there, so there is slow flow of CSF into the venous sinuses, okay, or venous flow. So that's why so there is slow absorption or there is resistant to absorption. So that's why so there is even though increased volume is there, but absorption is some extent is there. So that's why so the pressure is not much high. So the pressure is high, okay, intracranial pressure is high, but it is high normal limit. So that's what is called as a normal pressure hydrocephalus. Next, what are the symptoms? So it is a slow progressive disease as usually seen in the old age patients. So there may be apathetic and dullness and not willing to talk, as well as disorientation of the both physically as well as mental disorientation will take place. Next, along with that, so there is slowly progressive memory as well as gait abnormalities as well as bladder abnormalities will also take, or autonomic abnormalities will also takes place. Next, what are classical symptoms of the disease? So the classical symptoms of the disease the mainly the three features. So the first one is abnormality of the gait, and the second one is the memory or dementia, and third one is the bladder incontinence. So these are the features of these are the classical triad of NPH: abnormality of the gait, abnormality of dementia, and abnormality of the bladder. So incontinence of urine is present. So these are the classical triad of the NPH or normal pressure hydrocephalus. And the most important thing is, and the most important feature is the gait altered gait is not due to the atoxic gait. It is due to it is mainly it is mainly due to the apraxic gait. So the patient doesn't know how to step. Next, and the appearance of gait is magnetic gait, and the appearance of the gait is magnetic. So the patient feels that. So there is the stucking of the foot to the floor. That's what is called as a magnetic gait. Next, what are the investigations? So on investigation on CT or MRI or on radiological study, so there is dilatation of ventricles will take place, but there is no cortical atrophy because intracranial pressure is not high. So that's why cortical atrophy usually not seen. So increased intracranial, so dilatation of ventricles and without cortical atrophy. Next, on lumbar puncture, so the CSF pressure was increased, but the CSF composition is normal. So these are the classical investigatory features of the normal pressure hydrocephalus.